This program contains content that may not be suitable for viewers under the age of 18. Viewer discretion is advised.
Ruzungu kade kazuku tujikole sawa namba ruzungu.
Ruzungu tugenda muza kujjere kutoka ntoko ndimbuzi ndi ala bora babaddi abakyala
wale somoyo mbenye katonda ya chembuto genda weji waminge
yabaweereza buno bukeeke obutini
singa babu mutwale bamusonseka mukamwa bwonna n'abufulumiza mu nnyindo
kibwa ina guno omuggo gwa Musa white premium detergent
waliwo wanagambye munda y'akasajja kasendi kalimba bannange esendi bannange. Kale, welcome to yet another edition of Kasuku Live, and Kasuku is my name. As usual, we always come and speak to the doctor.
Yeah.
And in the doctor ELADU, Emmanuel.
Yes, so
how are you doing?
fine, thank you. How are you?
I'm okay.
Yes.
How's life? Life's good?
Life is okay.
Someone came and told me, actually, the last interview we did about erectile dysfunction. Was it? Yes, the last one we...
That one was, the last one was on infections.
The last one was on infections. Nga bambuuza omusajja adde omubuuza biki ebyo omubuuziza ebintu eziseko katazi muyitemu kyokka obedde ali serious naye mbagamba but now you people these terms okitegedde
We shall try to simplify.
Omanyi muzeeyi amala emirundi nga tannafa yatunyumizaako emboozi nti waliyo essomero ly'abasisita eyo waliyo mutabani omwana yali asomerayo naye ng'amukola ebigambo awemula kati ne bamuyita ne bayita omusajja omuzadde nti jangu ne bamugamba nti n'ababuuza ki ekibaddewo mutabani wayogera ebigambo kati psychology gwe yabazanya yabaga nti bigambo mubimbuulire kati asista ne babyogera n'abagamba olaba mu kutona byogedde ate olwo abatambula nabyo kati abantu abamu bajja ne baŋŋamba nti Kasuku dokita n'omugamba ebintu ebyo byasiiba alaba ono gayina
byenkola.
Yes. So kati ye tewali kimutiisa okitegedde. Yeah, but it's good to have you here.
Pleasure.
Soko buze kuba tulaba n'abatuwuliriza.
Mjebaleko. Mwasibe mutya. How do they say that?
Mwasibye mutya.
Mwasibe mutya.
But you can say mwasuze mutya, mwasibye mutya, muri mutya.
Muri mutya.
Because we have people from China right now. Hey, by the way, Kasound, we have people from China right now. It's around like it's coming. China is 5 hours ahead of us. Yeah. So right now it is 7. You see? Then we have those in Europe. Bazuka buzuku sikati abamu in some US
also
yeah.
Morning hours. Yeah.
So yeah, it works anyway that way.
But most welcome for another session.
Yes.
Of Meet the Doctor.
Speak to the doctor.
To the doctor.
Yes. And of course it's at TMR Hospital.
Yeah.
Njagala kwebaza TMR Hospital. Okay. Nina one of my friends omwana abadde mulwadde. Na bamutwala buli wamu. It's been now like a month and a half. And there's no improvement. By the way, I think we also need to talk about nature netaga cha dressing ne body ekolira abasawo.
Ministry.
I don't know. I don't
medical
know.
council.
I don't know how a hospital does tests on someone, gives, or what they get wrong diagnosis, or what they give wrong treatment, I don't know. You know, it's because you know I'm asking that. How this person calls me on Sunday night, Sunday evening, to tell me, hey, mana ekati, because I was asking her, hey, how is your daughter? So she tells me, no improvement. Like, it had become that serious. People were actually going to the hospital and thinking, like, you know that situation where, because katife wano anaga nti omwana wange mulwadde oba senyiga oba musujja, and you're like, but the moment we start visiting the hospital, you expect, it means things are serious. And these days doctors say infection. So I ask her, how has it been? She's like, hey, we've been 1 month and a half, we are in and out of hospital. Now they've told me they need to do tests again, and yet they've done them before. They are saying she was saying they told her they need to do the tests again just to be sure the first tests they did are accurate, because the kid was not over improving. Nemugamba kubira Dr. Dennis ku TMR era nga amukubira abe yamugamba nti Kasuku yansindise, nomugamba ajangu kati nga bagenda wa PID, kumbe omwana ayina obuntu obwali bumuluma mu bulago ne babawa eddagala awo by 9 omwana yali ayimba. But it's something that has been paining them for 1 month and a half.
To be honest, health costs in healthcare are expensive. But also, you see, we have not yet reached that state where, much as we say health is free, it's not free. You get it? People out there must learn that you need to go to the right hospital to see the right kind of doctor. You get it? Now, for me, being a guy, if you brought me a problem of a child, even if I used to know those things, I am not an expert there. I am likely to recommend Omwano Yalaboche a pediatrician. So people in the past used to fear seeing specialists. But if you go to Europe, you go to the UK, there are specialists for everything. And the specialist in that area is an expert. It means that when you see that specialist, you would spend less. It seems like you're spending more, but you get healed faster. So even the hospitals outside there, I'm not in the best position to speak about hospitals, but I would think that there is a lot we need to do as hospitals out there, because people spend money and people live from hand to mouth. You have to pay school fees. So if you're going to do a test, you want to make sure that that is the final test you're doing, so that the patient gets fine. I know. So there's some hospitals and some people may be crooks. Just like there are bad eggs or bad apples in every profession. I know. So there could be some of those out there.
So, but I want to thank TMR Hospital. Doctor oyo omukyala pediatrician yani gwe twaliko naye wano Omutoro, what's her name?
Anidora?
No, Dora. Why Consolate. Consolata. We did an interview. She's the one who worked on the kid. And the kid is now well. So Dr. Consolata is soda on me.
Amen.
Or maybe we can catch a drink. Now that people call me Baby Cuckoo, maybe she can check me out and you know. Now, today we are going to talk about fibroids.
Yes, sir.
Ebizimba. For starters, when you get to the part of explaining them, I want you to tell me, is it true they come because of lack of sex? Because they've told us there are people who have fibroids and it's because they are not banging.
That's not
or
true.
They're not getting banged.
But we shall explain.
Okay. Kali. Let's start there. Fibroids. What are fibroids?
Okay. So,
what causes fibroids? How best do we treat fibroids?
All right. So fibroids are abnormal growths munabana in the uterus. Okay. The uterus is the area in the woman that takes or allows the baby to grow. Okay, it's the part that expands and all that. So that uterus has got different layers. Okay, Katebizimba, for them, they start growing from the one of the layers called the muscle layer, the myometrium, mu uterus, mu nabana. So in simple terms, they are abnormal, non-cancer growths
in the uterus.
in the uterus.
Yes.
Okay. Now, they are abnormal, yes, because they're not supposed to be there. But also, rarely do they become cancer. It means that you can have fibroids for a long time without really
anything,
without getting cancer out of it. You get it? They are very common among people of black skin, all right, Africans of African heritage, descent, and all that. And some of the reasons explained is that we have our skin doesn't allow us to absorb enough vitamin D from the sun, and vitamin D would ideally help control the overgrowth of some of these things. Number two, genetics. If you come from a family where you're saying your mother had fibroids, you are at a higher risk of also getting fibroids. Currently, we do not know the exact cause that this is what causes the fibroids to grow, but we know that if your mother had fibroids, your auntie had fibroids, you have a likelihood of getting fibroids.
Yeah.
There are what we call risk factors. These are things that could predispose you into getting fibroids. For example, starting your periods very early. Okay?
Very early is how old?
Below 13 years. People start getting their periods around 11 years. The thing about fibroids is that the hormones of menstruation, last time we talked about the menstrual cycle. Kati mu cycle eyo waliwo hormones. Usually when you say hormonal imbalance, so there are hormones that would help the nabana to prepare to receive a baby. Unfortunately, those same hormones can trigger the fibroid to grow. So it means that if you start your periods early, you're going to be exposed to those hormones for a longer time. And when you're exposed to those hormones, then the fibroids, if you're at risk of getting them, will start growing. Okay? Number two, delaying to conceive or taking long to conceive.
Yeah, we were very theory. Yeah, you're not banging.
So it's
enough.
not really the intercourse, it's just
Getting pregnant.
Because when you get pregnant, some of those hormones that would be responsible for the cycle are sort of changed. Okay? So you find that you will not experience your periods for 9 months when you're pregnant. So meaning that during that time, there is the chance of that fibroid growing or increasing in size, and as much as some fibroids grow with pregnancy, but we have seen that somehow there's a decline, okay, during the
pregnancy.
Yeah, so people who tend to have children and all that tend to have a reduced risk, not an impossible risk of getting fibroids. Number three could be people who take long to get into menopause. Again, it means that if you are to get into menopause at 55, at 60, you are exposed to those hormones.
Menopause comes at what age?
Usually
exactly? 50. So menopause, you don't go into your P's anymore?
When you reach menopause, it means that you no longer have eggs in your ovaries.
They are dried up.
So the ovaries, yes. Okay. That is...
but is there a chance that they can come? The eggs, they can come back?
Women are born with all the eggs they will ever need.
So when they dry up, they are dry.
So because they keep reducing, from the time a girl child is born, the eggs reduce. So by the time they start their periods, they're losing eggs. So they reach a point where they no longer have sufficient eggs. So if you don't have an egg produced, Nabana cannot prepare to receive a baby. So it means you cannot have a period. When you take 12 months without a period, I want to come or menopause.
Okay, a full year.
So if it's just 6 months, you are not yet in menopause. You could be around menopause, but not in menopause. Not yet. So people who get their menopause later are exposed longer to
because hormones. The other hormones
keep on being formed and
so fibroids is a hormonal issue.
So the hormones stimulate the fibroids to grow. Okay, but what causes it exactly? Genetics. All right, genetics. Now there are two kinds of people. There are those who have fibroids and they don't show any symptom. And those are majority of people.
So how do you know someone has fibroids?
Now, the second category are those who have symptoms. Those are very few people. One of them is that because these fibroids are in the uterus, they make the uterus to expand, to grow. Okay? So that person will start getting heavy periods. Normally, periods are not supposed to go beyond 7 days. But for you, when you get your periods, you take about 1 week, 2 weeks when you're bleeding. There are higher chances that the fibroids have expanded the uterus. Number 2, painful periods. Okay? If you get fibroids, the uterus, ideally, during the time of the period, the navana has to contract. During contraction, that contraction stops bleeding. But if ngawine bizimba mu navana, those contractions will trigger painful sensations. So that person ends up having too much pain
when they are in their periods. Some
of them get a cannula and all that. Number 3 is that because the fibroids grow, they start pressing on other structures. Murubuto. For example, they can press on the bladder, akawago. Then that person starts going to urinate all the time. All the time. Or if the fibroids press the rectum, you end up getting constipation. And some of them even get pelvic pain. They just feel pain. Murubuto. Some of them even get the stomach to get swollen. They look like they're pregnant.
Waliwo omuntu lubuto yali azimbye olubuto tugamba ali lubuto twagira mbu bamulongoosezza mwana bamugyemu bujja nga tannatuuka oba.
So some of them, I've actually seen someone who has fibroids and they look like 7 or 8 months pregnant. And then
naddawo.
And then the person gets fine. So majority of women don't actually know they have fibroids. And you see it's actually serious because statistics show that 6 out of 10 women are at risk or could be having fibroids. That's a very big number. And that number's over 70% of women in their 50s, African women, have developed fibroids or could be having fibroids. So many of the patients we get to have fibroids didn't know they have fibroids. Maybe they came, they are pregnant, no color scan, hey, you see that they have a fibroid. You can actually have fibroids and you feel nothing.
It's business as usual.
Yes, no more periods, no pain, no pressure symptoms, no swelling. Then the problems usually come in when the fibroids start growing. Because as you keep going to your periods, they keep growing. Now that growth is what starts to cause the symptoms. So that brings us to maybe the next chapter is what tests do we do? A scan. Scan is one of the most reliable tests that we do for fibroids. And if you're there, you've never done a scan, please make sure that you've done a scan. At least get to know from your scan if you have fibroids or not. It's an abdominal scan. It's quite affordable. Yeah.
So how do they treat them?
Managing fibroids depends on the symptoms. Okay? Because if someone has no symptoms, they're fine. Okay? And the fibroids are small. Most times we just observe those people. There's what we call conservative care. It means that person can actually come every 6 months or every year. Netukola scan. We just do a scan and see how have the fibroids increased in size, have they increased in number. Okay? The scans that you do, a scan sometimes does not show the entire picture. Scan can only see the bigger fibroids. And sometimes I've seen patients who come, we do a scan shows, oh, you're in 4 fibroids. By the time we opt for surgery and we remove the fibroids, tusanganga aina 13, 15 fibroids. So the scan can only see the big ones, not the small ones. So sometimes some people get misled by that. The scan is saying only 3 or 4, but the symptoms are there. So number 1, do you have symptoms or not? If you don't have any symptoms, you're getting pregnant normally, your periods are normal, there should be no need for surgery. And sometimes I think that's where we doctors, we go wrong. Every time someone sees a fibroid, they scare the patient. So you find someone is very afraid that they have fibroids, and I think that not every fibroid is for surgery.
It's for surgery.
You get. There's some fibroids where you just monitor the patient. If someone has fibroids and they're about to reach menopause, and the fibroids are small, why are you operating them? You get it? Because when they reach menopause, that fibroid is going to stop growing.
And
some of them even start regressing and reducing in size. So not every fibroid is for surgery. The second one are people who have symptoms, but the symptoms are not affecting their quality of life. For example, you have pain in your periods, but besides that, you are fine.
You're okay. You just worry about that time.
The time during the periods.
Yeah.
So for such people, we can manage them symptomatically. That can help you during the periods. You take that medication, it controls the pain. And then you proceed. So you don't need surgery, but we can manage the symptoms. If you bleed too much, there are drugs we can give you that can control the bleeding during the periods. Okay? If you're someone who has reduced your blood level is low, or you have anemia, we can give you a dagala that can improve your blood levels. You get it? Because I've seen some women who have fibroids, and every time they go into their periods, I know for no side, she has to be transfused.
Wow.
Because she loses so much blood. Now, if you've not reached that point, you don't need surgery. You get it?
You don't.
And there are people who are just not ready. They'll tell themselves, yeah, I made, but I'm still doing other things. So we can manage the symptoms. What I want people to know outside there, that currently we do not have medicines that you can swallow and the fibroid disappears. They are not there. There is no currently, much as the drugs are on research and all that, but we do not have a drug that is in the market that we give to patients and then the fibroid disappears. We do have injections that can reduce the size of the fibroids.
But they don't go away.
And also we can't use those injections indefinitely. Why? Because they cause menopause. So you don't want someone to suffer with the effects of menopause before they have reached menopause. You get it? So for those injections, we give 3 injections at most. We give them monthly, but the reason is to either reduce the size of the fibroids to prepare the person for surgery. You get it? Because if the fibroids are very big, the surgery is more complex.
Yeah, I know.
If the fibroids are small, the surgery is less complex. So those injections exist also to improve the blood levels. Because if you give those injections, it will cut off the menstrual cycle. It means you're not going to bleed. It means you don't lose blood. You get it? So we improve your blood levels. All those things are done to prepare you for surgery. The third one are people who want to conceive. So that people want to conceive. And you see, for you to conceive, your uterus should be conducive. If you have a vizimba and you're struggling to conceive, most likely the first thing we want to deal with are the
Vizimba.
Okay? So there are those who have a reduced quality of life. Every time they get periods, they are scared. They are going to get transfused. They're going to be in hospital. If your fibroids are affecting your quality of life, then you benefit from surgery.
Yeah.
Okay? So surgery has 2 forms. What we open surgery, the laparoscopic surgery. Open means we make a wide incision, and normally it's for big fibroids. So if you've taken long, they've told you to do surgery, you've taken long, now you look like you're 8 months pregnant, laparoscopic surgery might not be the best option for you.
You need to open.
We need to do an open surgery so that you can remove as many fibroids as possible. But if you have smaller fibroids, fewer fibroids, the symptoms are there, but you have fewer fibroids, then you would benefit from laparoscopic surgery. Usually we say 4 or 5 fibroids. We've even seen laparoscope remove over 20 fibroids, but they should be small, not extremely big. So that is laparoscopy. And laparoscopy is very good because you recover quickly. I think you had that session with Dr. Chiwa.
Yes, I did.
You recover quickly, you stay in hospital for a short time, the pain is well controlled, and you get to do most of the things within a short time. So laparoscopy or open surgery. Then there are newer techniques of dealing with fibroids. These are for people who do not have chances of giving birth, or they don't want, or they've reached the end of the point of giving birth. There is what we call uterine artery embolization. So these fibroids grow by having increased blood flowing to them. So sometimes we can give you a dagala, or we can introduce a few things munabana that can block blood flow so that the fibroid suffocates.
Technology.
So those are now newer technology, uterine artery embolization. There are also techniques of dealing with fibroids without surgery. For example, there's what they call HIFU. HIFU is a newer modality where they use scan rays. The machine is called a HIFU machine. So you go and lie on the machine, the radiations or the rays from the scan direct to the fibroids, and they help to shrink the fibroids without you getting a cut on your body.
Oh, but that must be expensive.
Currently, we don't have it in Uganda. It's in Nairobi. It's about 15 million or so, average.
But it's effective.
It does work. We've seen people who have gone for HIFU and their fibroids have shrunk or reduced in size. So there is HIFU. Then there are people who really are just tired. They don't want to give birth. They have reached or they're near menopause. The symptoms are severe and they have nothing else to do with their uterus. Abo to call a hysterectomy.
Hysterectomy church.
Hysterectomy means tujamu nabana. So when you remove the uterus, it means that you do not have any chance of the fibroids regrowing.
That's like the last option.
That is like the last
for
option.
The tired ones.
For the tired ones. Okay, so it's not the first option we recommend. I think I saw a celebrity, I think there was Lupita, who talked about she underwent fibroid surgery, then they removed over 50 fibroids and all that. And I think either that suggested that for her. But you see, that's usually the last option.
The last option, yeah.
We don't recommend it as the first option for.
Because man, taking your uterus.
Yeah, but you see, if you've reached, or if you're near menopause, and you don't need to use the uterus again.
Anyway, yeah.
You get it? Because the uterus, if it is idle, is a potential structure for many cancers.
Yeah.
Osobola funa cancer of the cervix, osobola funa cancer of the uterus, osobola funa cancer of the ovaries. You get it? So if at all you do not have any plans of giving birth, or you're near menopause, so that may be the most logical. Because once you remove the uterus, you no longer have to worry about these cancers.
I know. Kali, so briefly, tukutudde fibroids. Abagala okumanya ebisingawo, Dr. ELADU.
Yes.
You can go on the TMR Golden Living app.
Yes.
You ask the questions.
Yeah.
You have a YouTube channel.
I have a YouTube channel, and I talk about some of these things on the YouTube channel as well.
It's called
ELADU Emmanuel. Just ELADU Emmanuel.
Not Doctor.
Okay, Dr. ELADU.
Dr. ELADU Emmanuel. So you can go there. We actually always collaborating with him on our YouTube channel. Yeah. And then, of course, you can come by TMR Hospital here at Golden Living, and you talk to him or any other doctor that you'll find around to try and break down for you some of these things. Yeah. Thank you for your time. And I'll be seeing you again soon. For now, bye.
Bye.
The views expressed on Kasuku Live do not reflect those of the host, producers, or management. They are solely of individuals providing them and do not represent or reflect the official policy or position of this YouTube channel.
Abakyala
wereso omuyomba enyembuto katonda yekyembuto genda wegiwaminge
yabaweereza buno bukeeke obutini
singa baaba omutwale bamusonseka mu kamwa bwonna n'abufulumiza mu nnyindo
Kibwa alina guno omuggo gwa Musa wayitista premium detergent
waliwo wanagambye ebola y'akasajja kasendi kalimba bannange esendi bannange